Yeah.
Okay.
Let's remind people that there are 40 people listening in.
So we have 40 listeners, just to remind people, so we do have people listening in. I am told that we are Zoom ready because for the next presentation, several of our presenters will be joining us by Zoom. So we're going to now spend 2 hours where we want to take a close look at consumer and provider perspectives. And the way this 2 hours is structured is that we'll spend the first, hopefully a little less than an hour, so we end up at the very end with things that may cross between the two segments that we're about to have. But the first we'll focus more closely on consumer education perspectives. And in the second part of this, we'll look at provider perspectives. And what we're looking to do is collect, we appreciate you all joining us to help the committee understand more about the consumer and provider perspectives related to clinical utility, to safety, and to effectiveness of the compounded bioidentical hormone replacement products. We want to look at trends that you can help us understand about usage, specifically education materials, health information that are provided to consumers, and how and why, if you can, help us understand how and why medical decisions are made to use products, select which ones, and engage with them. So for the first consumer education perspective, we will hear from Phyllis Greenberger, who is the Senior Vice President for Science and Health Policy with Healthy Women. And then she's here with us in person, and then we have 3 others that we'll be hearing from through Zoom. One is Cindy Pearson, who's the Director of National Women's Health Network, Jay Campbell, who is an author of the Definitive Testosterone Replacement Therapy Manual, and Lynn Hogreave, I'm apologizing if I mispronounce anyone's name, who's the founder and the executive director of Happy Hormone Cottage. So for each of those 4, I would ask that you spend 5 minutes just letting us know who you are, your perspective, speak to those things that I mentioned early on, because we really do want to have time to ask you questions and hear specifically from committee members about specific questions that people have. And again, our appreciation to you for really helping us understand the perspective of consumers, of users, how, why, what does this look like, what does it feel like, so that we gain more insights. I'd like to also remind people who are joining us on the phone or electronically to please submit your questions to bhrt@nas.edu, bhrt@nas.edu, and we will certainly do the best that we can to incorporate your questions into the segment that we provide for Q&A that will follow the initial comments of our 4 presenters. So with that, I'll turn and ask Phyllis Greenberger to lead us off. Thank you so much for being here. We really do appreciate it.